Hi guys, another live interview in our YouTube channel. Before start, I want to underline that I'm an endodontist. I don't work in cinema or interview something. We have another endodontist that in a minute I will introduce you. I want to just explain that we organizing this interview with the speaker, with endodontist. The group is driven by Laura Andracateni. And just to say, Laura, you did very well job, fantastic, amazing, isn't it, right? She asked him, what you do endodontist, you do this, you do that. We are very multitasking. This is ESE 2023. So now, let me introduce a friend of mine, Elisabetta Cotti, for me, but it's Professoressa Elisabetta Cotti for the other, all right? So Elisabetta, ciao, how are you?
Ciao, how are you?
Fine, thank you,
I'm fine, very happy to be here.
And Elisabetta, you will have topics, talk tomorrow, 45 minutes, 9 o'clock, hall 1. And again, guys, don't miss this appointment because the topics, you told me that it's very fashion, very attractive, yeah? It's, can you just, in few words, what you are talking about tomorrow?
Thank you, first of all. I love to be discussing about my topic. It is, I wouldn't say it's very attractive. I think it's interesting because we're moving a little bit attention from everyday endodontic treatment to the host. There has been a big increase in attention in the last 20 years on perfecting instrumentation techniques, and we're getting almost to perfection. But we still have a component of treatment that has not been taken care of, which is the host. So the person we're treating have different reaction to different treatments. And taking a little bit of attention to what's happening to the person that we treat may enhance our success rate. That's what I think.
No, that's good. So the title will be Factor Affecting Apical Periodontitis. Professor Elisabetta Cotti is professor in endodontics at Cagliari University. Cagliari is Italy, the best island, Sardinia Island, amazing with the summer, fantastic, and then also professor in endodontics at Loma Linda. So I guess that yes, the topics for me is attractive because as an endodontist, I never thought to be in the other part of the moon, in the other side of the moon. But this is important for an endodontist to understand the factor that can affect the apical periodontitis. So the patient is important to keep the patient in success rate for sure, but we want to preserve any additional or increase the risk to ever get a problem after root canal. So that's the topics, if I'm understood well, correct?
Yes, you do. Basically, the most important issue in preventing or treating apical periodontitis is developing a good clinical knowledge and a good clinical and surgical technique. That's out of question. But we need to save a space to consider the reaction from the host. All of the medical field in the last 20 to 40 years has been focusing on the different reactivity of the different organisms. That means that some people are hyperreactive to any possible injury coming mostly from bacterial infections. And that happens in endo as well because we're treating human beings. And so a little bit of attention has been taken by the research in the last 20 years, trying to find out the different predisposing to inflammatory reaction of different people when they are challenged by microorganisms, like it is happening in endodontic disease.
Sure.
So now I think putting together the experience of multiple patients with different treatments, both in endodontics and in medical treatments, we're starting to observe that some of people react differently from others, so they may need a little bit more help in healing, even apical periodontitis. So that's where my conversation is leading to tomorrow.
Yeah, the appointment is for tomorrow. But let me ask you something. For sure I will be tomorrow to attend your conference, but when I come back Monday, after watching your presentation, what can change in my daily practice, endodontic daily practice, starting from Monday?
Starting from Monday, I'm afraid not very much, but,
That's
but it will resolve some of the frustration because sometimes we do really everything state of the art, yet we don't produce the healing rate that we would think we would. So basically, the next move is to realize that sometimes people don't heal, even apical periodontitis, simply because they're reacting too strongly to the bacterial infection. So helping this reaction may change our future. So I'm basically addressing the question, and now there are many other people studying in the background how different organisms react to endodontic infection based on their genetic asset. And so how can we can interfere getting this 10-15% healing rate potentiated.
Okay, so actually, if can we say maybe in the future we can treat our patient with maybe some pharmacological support after that one, so we can put some or suggest some pharmacological support to the patient to get better recovery?
I really hope so. When medicine is based on using both surgery and therapeutics in terms of medicaments, so why not in endodontics? We can probably add something to our cleaning and shaping routine pretty soon, I think. And many people are working actively into these details. But also, as I said, less frustration. We will get in closer to identify the patient. We will be not so responsive to treatment as it's happening in medicine. And so we will look at alternative pathways.
Oh, that is fantastic. So I'm very look forward to watching that, because the fact that if we get a no success rate so high after root canal, the endodontist thinks it will be in trouble with itself. You think about, but sometimes it's not like that. Sometimes you said that probably we need to get maybe go behind that one, and so because we are talking about the present, but I think this is the future.
I think it will implement the future.
So guys, I think that tomorrow morning 9 o'clock, all one, Elisabetta will explain us everything, and I think you will be bravissima tomorrow, right?
Hopefully, don't party too much tonight.
No, absolutely. We have some drugs instead, some pharmacological can help us. So thank you, Elisabetta. Thank you for coming. Thank you for the interview.
Thank you.
And guys, see you tomorrow with Elisabetta. Don't forget.
Thanks.
Thank you. Bye.
Bye.
Ciao.